Hello, I'm Marcia Mott, and I'm the coordinator for the University of Florida Health Wellness University. We have a great presentation today called the MindGut Conversation. After the presentation, we're going to answer questions. You can submit your questions at any time using the question and answer feature at the bottom towards the right of your screen. I will anonymously read your question out loud at the end of the presentation. Dr. Irene Estores is the medical director of the Integrative Medicine program at UF Health. Dr. Estores and her team offer an integrative medicine approach when caring for hospitalized patients and to patients at their UF Health Spring Hill outpatient office in Northwest Gainesville. We're very fortunate to have this robust integrative medicine program at the University of Florida Health for our community. Dr. Estores, I'm going to turn it over to you now. Thank you.
Thank you, Marcia. Welcome.
We hear you just fine.
Let me just ask you, do you remember how you felt when you sat next to your biggest crush, your first date, or before your big job interview? Maybe you sensed butterflies in your stomach. In the 1990s, Dr. Thomas Almy, a gastroenterologist, performed an experiment to find out what happens in real time to the GI tract, specifically in response to different stressful events. One stressor was news about troublesome events, such as a possible diagnosis of cancer. In about half of their participants, they demonstrated changes in color, contractility, tension in the GI tract. And then when the participants were reassured that the diagnosis was not cancer, the color and the contractility and the function of the gut returned to normal. It basically relaxed. So this tells us that the sense of butterflies in your stomach is real. That is your mind and your gut having a conversation. By participating in this webinar, you will gain knowledge about the physiologic basis for this conversation, which we call the brain-gut axis. You will also learn how hypnosis utilizes this powerful connection to treat several behavioral and mental conditions. For today, I will focus on what is called Gut Directed Hippotherapy. I'd like you to meet the vagus nerve. The Latin word vagus means wandering, from which the words vagrant or vagabond are also derived. It arises from the lower portion of the brain, the medulla oblongata, and wanders all the way down to the lower viscera. Along the way, it travels to the larynx, to the lungs, to the heart, and then all the way down to the gut. So it is also called the pneumogastric nerve, or the pneumo for lung and gastric for the GI tract. In 1921, a Nobel Prize winning physiologist, Otto Loewi, discovered that stimulating the vagus nerve resulted in the release of a neurotransmitter, which we now know as acetylcholine, causing a reduction in the heart rate. Acetylcholine is the predominant neurotransmitter of the parasympathetic nervous system, or our rest and digest system, as opposed to our fight, flight, or freeze sympathetic nervous system. Because of this vast and long network, the vagus nerve is similar to a communication superhighway. The gut can send signals to the brain using nerve impulses, hormones, and peptides or proteins that can influence mood states. And as I mentioned earlier, certain emotional states can also influence gut behavior, such as the motility of the gut, blood flow, and muscular tension. And this information goes two ways. It is bidirectional, just as you'd expect from a good conversation. The gut is often referred to as the second brain because it is richly supplied with several neurons. As you can see, 84 to 100 million neurons, less compared to what is in the brain, but still a sizable amount. And even if the neural connection from the brain to the GI tract is severed, the gut can act independently and communicates with other body parts through hormones, peptides, and neurotransmitters. It actually produces half of the body supply of serotonin, a neurotransmitter more popularly called the happy chemical. And it is the target of a class of drugs we call the SSRIs, the serotonin receptor inhibitors, widely used to treat mood disorders such as depression. However, serotonin also affects the smooth muscles of the gut, and it also affects the smooth muscles in the lung bronchioles. It plays a role in inflammation and immune regulation through its actions on our blood cells. Most of you are probably familiar with the concept of the gut microbiota, which is a community of commensal, symbiotic, and pathogenic organisms within a body space or an environment. So there are different environments in the body, such as the skin or the outer ear canal, but the biggest environment for microbiota or microorganisms in the body is the gut, which begins from the mouth and extends to the large intestine. The gut microbiome and gut microbiota terms are often interchangeably used. So I want to point out that the term microbiome refers to the trillions of microorganisms and their genetic material living in the GI tract. So that could be bacteria, fungi, viruses, and protozoa. So I am pointing this out to show you that the effects of mind-body interventions as mediated by the gut microbiome extend to the genetic level. So very powerful. As you can see, the gut-brain axis is affected by several factors: prenatal and birth events, diet, drugs, chronic stress, and disruptions of this axis are associated with a diverse spectrum of diseases such as anxiety, depression, and GI diseases, including irritable bowel syndrome. Most of the research has been conducted in animal models, but this provides a strong, plausible mechanism to explain why mind-body interventions work. So we have covered the brain-gut axis, the vagus nerve, the enteric nervous system, and the gut microbiome, so that we show that this is the physiologic and biologic basis of the brain-gut axis and the mind-body conversation. So this is a powerful connection that plays a powerful role in health and disease. And one of these mind-body interventions is hypnosis, which we are going to cover next. Hypnosis is among the oldest therapeutic interventions that tap the mind-body connection. And it has experienced alternating times of acceptance and rejection. Let me tell you a story. I first heard about hypnosis from tales of my maternal grandfather, who I was told was an excellent lay hypnotist and practiced his skill on my grandaunts. So when I got around to ask him the truth about this, he just opened his eyes and started laughing. So I really don't know if that was urban folklore, but I became introduced to it professionally when I was training to do an integrative medicine fellowship at the University of Arizona. And I was slowly entranced and introduced into this body of knowledge by looking at the literature and learning from several healthcare professionals, including physicians, on how this can be integrated in medical practice. There are many ways to define hypnosis, but I like this one, which comes from Dr. Lauren Sugarman, a pediatrician who has masterfully integrated hypnosis in his clinical practice. He says, hypnosis is a skill set involving interpersonal communication designed to facilitate therapeutic change in maladaptive psychophysiological reflexes. So an example of a maladaptive psychophysiologic reflex is a heightened sympathetic nervous response, being continually in fight, flight, flee, or freeze mode. But he also gave a better one, which comes from James Warren, who is not a medical hypnotherapist, but he's a psychologist, a psychotherapist, and Episcopalian priest, who says that hypnosis is art and science masquerading as conversation. And what he says is that all powerful communication is hypnotic. Hypnosis has been used in clinical situations to treat several behavioral conditions, as you see there: phobias, nicotine dependence, insomnia, persistent pain, and in physical conditions such as warts, prior to procedures such as biopsies and MRIs, and prior to dental procedures. And it is an effective intervention to treat irritable bowel syndrome and is being explored as adjunct treatment for inflammatory bowel disease. This is an example of using hypnosis in a medical setting, and it comes from the work of Dr. Elvira Lang, an interventional radiologist and hypnotherapist, now retired from the Harvard Medical School system. They studied the effect of hypnosis in the interventional radiology suite for patients who were undergoing percutaneous embolization or radiofrequency ablation of liver tumors. So one group of patients received empathic attention, as you see here, being nice, and the other group received self-hypnotic relaxation treatment, which consists of empathic communication and reading of a hypnosis script, which was done by the staff during the interventional procedure. So this was done while the patients were on the procedure table. The second group of patients who had received the hypnosis script, the intervention, had lower self-reports of pain, anxiety, and had less need for sedating medications, and had less fluctuations in their blood pressure and other vital signs. So because we are already wired with a brain-gut axis, hypnosis has been demonstrated to be effective in treating functional GI disorders, which will be the bulk of what we are going to talk about for this session. Functional GI disorders are characterized by persistent and recurring GI symptoms such as pain, bloating, cramping, diarrhea, nausea, constipation. They occur as a result of abnormal functioning of the GI tract and are not caused by structural abnormalities such as tumor or masses or by biochemical alterations. So irritable bowel syndrome is an example of a functional gastrointestinal disorder. Gut Directed Hippotherapy as treatment for IBS is a standardized protocol that was developed at the University of Manchester, hence the name Manchester Protocol. It was first developed in 1984 by P.J. Worwell, but it has undergone several adaptations, and currently it consists of 12 individualized sessions and a daily practice. The Manchester Protocol has been further modified by Dr. Oliver Paulson, who is a psychotherapist at the University of North Carolina, And the way that he adapted it was he used 7 sessions that are conducted bi-weekly. And there is a supplemental session 1 month after the series of 7 sessions, and then 3 months after that 1 month. So it's spread for a longer period of time, but it also uses a daily hypnosis practice using a self-recorded script. So this is the protocol that we use in our program here at the University of Florida Integrative Medicine program, because I was trained to use this protocol. And there is another protocol that has been developed at Monash University in Australia. So this was developed by the group of Peters, and they have used 6 sessions that's delivered weekly, and they also used daily use of pre-recorded CD with self-hypnosis scripts. So as you can see, an important component of all these interventions is a daily practice. Going back to what I showed you earlier, hypnosis is a skill set. And if we really go back to the father of hypnosis in the US, which is Erickson, he says all hypnosis is self-hypnosis. So what is the data on the efficacy of gut-directed hypnotherapy? Because after my patients ask me how hypnosis works, the next question they frequently ask is, how well does it work? Using data from several studies on using gut-directed hypnotherapy for functional gastrointestinal disorder, we see this as a review from Warwell's group, and this was a publication in 2019. The key point from the review is that it significantly improves symptoms in up to 76% of participants, with durable effects and important socioeconomic benefits. The benefits, of course, would be decreased costs of medications, ED visits, physician visits, and of course, effects on quality of life. And more importantly, it's the effects of hypnosis can be seen and observed. The beneficial effects could be observed 4 to 7 years after completion of therapy. Let me show you a few graphs to illustrate. So this data is from Warwell's group in Manchester, and it is their experience from 1,000 patients who received gut-directed hypnotherapy for IBS. They have an IBS severity scale. So using the IBS symptom severity scale with a higher score signifying more severity, we see a marked improvement in pain severity, bloating, bowel habit dissatisfaction, and life interference in overall symptoms after gut-directed hypnotherapy. As you can see here, this is the scores pre-hypnotherapy in the stippled bar, and this white solid bar shows the symptom severity post-hypnotherapy. And this is, as I said, markedly improved. Another interesting point that they observed is it is not affected by a person's hypnotizability. They actually measure that as part of their data, and hypnotizability does not seem to affect the outcome. What we know is about 55% of the general population is classified as low hypnotizable, but in spite of that, they still had this very robust improvement after a hypnotherapy intervention. As I mentioned earlier, the benefits are durable. Here's another graph, also from the Manchester group, showing the change in symptoms over time in persons who received gut-directed hypnotherapy for functional dyspepsia, another functional GI disorder. The line connected by the squares, as you see up there, represent the hypnotherapy group. And as you can see, there is not only a larger percentage change in symptoms, but there is also this percentage change is maintained without any decrement as compared to the groups for medical care and supportive care. I also mentioned earlier that the brain-gut axis has a communication superhighway, the vagus nerve, and that information is bidirectional. So let's look at what happens to the brain when that information is received. So this is a PET scan of a person who is receiving a hypnotic suggestion of low and high unpleasantness. So red, as you can see there, means higher activity, and lavender or blue means lower activity. The region of the brain that is in the red circle is called the anterior cingulate cortex, or the ACC. Among the functions of this brain region include emotion regulation, autonomic regulation, and affect related to pain. So hypnotic suggestions of low unpleasantness, as we see here in this brain representation, hypnotic suggestions of low unpleasantness evoke less activity in the ACC compared to what we see on the other side, where there is high unpleasantness evoked by hypnotic suggestions. So there is a real change happening in the brain as all this is going on. Several delivery methods, aside from in-person individual sessions, have been developed and studied. These include nurse-led interventions, primary care-based interventions, and a home-based interventions. So what we conclude from all these interventions is that they are effective, although not as effective as the individual sessions that I described earlier. So another intervention is a remote intervention. So in this case, the Warwol's group in Manchester used Skype. And they compared it to face-to-face treatment. Again, still good change, but not as robust compared to the in-person interventions. And with the pandemic restrictions, I have been able to use telemedicine visits for my patients who are receiving gut-directed hypnotherapy, following the guidelines of the American Society for Clinical Hypnosis. It is imperative that this modality be used only after a firm clinical diagnosis of IBS has been established. I cannot emphasize this enough. I recently saw a patient who was diagnosed with IBS without a full evaluation and who was seeing an acupuncturist for several months for chronic diarrhea and was not improving. I had to first convince him to at least do some testing, and if this was indeed IBS, to have a gastroenterologist evaluate. And after we did a basic stool test and some blood test, we found out that he had an uncommon form of diarrhea, chronic diarrhea caused by bacteria called Cryptosporidium. And it responds and requires a specific antibiotic. So this is very important. No amount of gut-directed hypnotherapy would have taken care of his chronic diarrhea. It's gut-directed hypnotherapy can also be helpful if the symptoms are refractory to pharmacologic treatment. In this case, the usual pharmacologic treatments are an antidepressant called amitriptyline, or a dietary intervention called the low FODMAP diet. This has been used in children, adolescents, and adults. And as I mentioned earlier, it is not dependent on hypnotizability. We are careful when we are working with persons who have coexisting and significant psychiatric diagnoses such as schizophrenia and bipolar disorder. It's used for persons with IBD, so in IBD meaning inflammatory bowel disease. So this is different. There is a structural abnormality here. So gut-directed hypnotherapy has also been studied as an adjunct for inflammatory bowel disease or IBD. So using a protocol developed specifically for IBD, and again, you see that Paulson is part of this development. They studied the effect of this form of therapy for persons with both ulcerative colitis and Crohn's disease. So in a single center trial in New York, they found that the participants who received gut-directed hypnotherapy and ulcerative colitis, 64% of them maintained clinical remission compared to only 40% of patients in the control group. So remission in ulcerative colitis with medications usually last for a year. With the addition of gut-directed hypnotherapy, they were able to extend this remission period. Clinical hypnosis is not stage hypnosis. It is not mind control. Several physicians, dentists, psychologists, and nurses have additional hypnotherapy training, and they use it in their practice. So please find a licensed professional therapist. So let's review. First, the mind-gut conversation has a physiologic basis that involves the vagus nerve, the enteric nervous system, and the gut microbiome. Several factors influence the function of this axis and has been associated with both health and disease. Clinical hypnosis can be used to treat several behavioral and physical health conditions. And based on current science, gut-directed hypnotherapy can be used to treat IBS and ulcerative colitis as part of an integrative health program. So the next time you notice a mind-gut conversation going on in your body, remember, you can use this powerful connection for your health. Thank you.
All right, thank you. That was a great presentation. I really appreciate that. We have some questions that have come in from the audience while you were talking. And so I'm going to go ahead and read a few of those questions and then continue to submit any questions if you have them. Our first question we have is, can you speak about MCAS in relation to the gut?
So I think they are referring to the gut dysfunction that is mast cell induced activation syndrome. So I'm thinking that MCAS means mast cell activation syndrome. So this is not my area of expertise. We used to have a physician in our GI group who had an interest in this, and I stay in my lane. So that will have to be turned over to our GI group.
Okay, so that person could follow up, or anybody else that has a similar question could contact their primary care, or if they already have a gastroenterologist, they could contact them and get more information about that. Okay, great.
Yes, because UF used to have a physician who was interested in that, but she's no longer with UF. Okay. But I'm sure there's someone in the area or something.
All right, thank you. Do you need a doctor's referral to participate in your program? And what does a session or procedure cost?
My practice is a consultative practice, and so this requires a referral from your primary care physician. And as I said, it's also very important that you have at least been fully evaluated by a gastroenterologist and the diagnosis of IBS is firmly established. The cost This is actually reimbursed by insurance. So your cost will be whatever your copay is.
Okay, another question we got is how long is a session? Like how long, if they had a session with you, would it take?
Typically, we schedule 30 to 40 minutes for this session if it's an in-person, and actually it takes shorter for the telehealth visits.
Okay. Here's another question we have. Can gut-directed hypnotherapy still be effective if the brain is compromised, i.e. lesions on the ACC or the ACC is otherwise not functioning correctly?
It has not been studied in that setting, so I cannot answer that directly.
All right.
We don't know, in other words.
Here's another kind of coverage kind of question that maybe you might answer to. Does Medicare cover the cost for this?
Because I do it I'm a physician, they're actually, so let me put it this way, there are specific codes for hypnosis. So psychologists have their hypnosis codes and they use that. And as a physician, I use my own codes as well. So I have patients on Medicare and I've been able to, build Medicare to cover the cost of the session.
Great, that's great information. Thank you. Will this work for Crohn's disease?
We do not have data that supports that it does. So, and as I said, it's the data in inflammatory bowel disease is early. So we don't know if they do further studies involving other centers for longer periods of time or a different protocol. I don't know if they will see improvements in Crohn's, but the data we have so far only supports efficacy in patients with ulcerative colitis.
Okay, kind of another similarly related question is, would something like this be effective for insomnia?
Not gut-directed hypnotherapy, but certainly hypnosis has been used for insomnia.
All right. Could you talk a little bit more about what is actually done in the treatment plan that you use? I believe you said that you use the UNC protocol.
Yes, that's correct. So there's a series of sessions. Each of those sessions are specifically scripted and developed by Dr. Paulson. So we follow that. We also ask our patients to complete an IBS progress questionnaire, which is part of the protocol, so that we can find out if this is working or not. So.
Okay. You covered this a little bit, but maybe this person would like a little bit more emphasis. What is the difference between guided hypnotherapy versus guided meditation?
So for gut-directed hypnotherapy, there are specific suggestions related to gut function. So that is the main difference. In guided imagery, of course, they give other suggestions for a different targeted outcome, for a different therapeutic outcome. And in most cases, also guided imagery is not directed for a specific medical condition. It can be used to reduce anxiety, help sleep, but I think it's the approach of guided imagery is broader.
Okay. Is there an age when men or women are more prone to GI dysfunction due to hormonal changes?
I cannot answer that question.
Okay.
That is
That's
not,
right.
I'm not an expert in that.
That's okay. I'm just a moderator, so I'm not an expert without either.
And that's one of the things that I'm honest about my patients. If this is not what I know and I can give an expert opinion or can treat you well, then I am very forthright about it. That's very important.
And I might get the same question here, but do you generally recommend gut-directed hypnotherapy as a first line of treatment for IBS, or is it often referred after other treatments aren't working?
The way that most of the practitioners approach this is we would like it to be, second line. The reason is that the low FODMAP diet is also effective to treat IBS. And it is a lifestyle that you can do. And of course, there are effective pharmacologic treatments as well. So, but there are other patients who find changing their diets very challenging. And there are some patients who don't want to take the medication or have adverse effects to it. And in those instances, gut-directed hypnotherapy is a useful thing to consider.
Okay. Do you have any thoughts about using hypnosis for anesthesia? And this person goes on to say, I'm familiar in Brazil with a prolonged waiting for patients in which they were inadvertently becoming hypnotized and then they were operated on with no anesthesia.
Actually, it has been used as an anesthesia for surgery. One of my teachers, I would say one of my teachers is a very skilled hypnotherapist. He's one of the biggest names in the hypnotherapy field.
Wow.
And he had a patient who was what we call a high hypnotizable patient. So there are specific cases where it can be successfully used. And he actually, so I attend, as part of my continuing education, I attend hypnotherapy conferences. And yes, he was able to successfully use hypnosis as the sole form of anesthesia for surgery. But this woman was prepped. This woman has been working with this hypnotherapist for a long time. And so in very, very few cases, but yes, it can be done.
Interesting.
Very few cases, okay?
Okay.
Powerful mind-body connection.
Yeah. Can you speak, do you think that this gut-directed hypnotherapy could use to heal chronic constipation?
So if this is IBS related, so IBS has different categories. There's constipation predominant IBS, diarrhea predominant IBS, and a mixed type. So yes, gut-directed hypnotherapy has been used for constipation predominant IBS. But again, we need to make sure that the constipation is indeed just due to IBS.
Okay. You mentioned a specific diet a minute ago, and someone asked if you could repeat what that was called.
It's called the low FODMAP diets. So there's foods that are high in fructose, oligosaccharides, disaccharides, monosaccharides, and polyols. And that is a whole new different presentation. Yeah. But yes, that is the diet that has been studied for IBS.
Okay. How do you manage a patient that is resistant to hypnosis, or how do you evaluate who would be responsive to hypnotherapy?
So there are different scales to measure hypnotizability. I mentioned earlier in the talk that the group of Miller used the Telegan absorption scale. So using that, you can measure a person's degree of hypnotizability. Spiegel in Stanford, David Spiegel, he's a psychotherapist and a psychologist. I'm not sure if he's a psychologist or psychiatrist, but he also has his own scale. So there are scales to measure hypnotizability. But as I mentioned, there are people who are, most of us are really in the medium to low hypnotizability range, and it's still, based on the data, it was still effective. Now, in terms of people who are resistant to be hypnotized, I can tell you that there are some very skilled hypnotherapists. They have many techniques, and they're able to work with them. So I think that if this is something that you would want to consider, and you could say, I have patients, I can tell you that I had patients who went in to do this believing or convinced that they won't be able to do this because they're going to resist it. And it's interesting if you just allow things to happen and be open, that a different outcome comes out. So
yeah, gotta be willing to give it a try. Okay, thank you. Another question I've got is: Are there other options to treat GI issues? For instance, would acupuncture help any gut-related issues?
So acupuncture has been investigated to treat functional GI diseases, and there is some limited data that it is effective. So again, there are just yes, acupuncture can be used for functional GI disorders, but the data is not as robust compared to gut-directed hypnotherapy. For instance, using hypnosis for functional GI diseases is in the mainstream GI journals. It has been in use for over 20 years. The level of data to support acupuncture is not as robust. But for someone who wants to use it as part of their treatment, it's certainly safe. And if it's done by a skilled practitioner, it may be helpful.
Okay, thank you. Let's see. Would gut-directed hypnotherapy do anything to help diverticulitis? Maybe in addition to the antibiotics they're taking for like a routine maintenance kind of a thing?
That has not been studied. So as I said, one of the things that I do as part of my practice is I make it evidence informed. So the evidence does not support that using gut-directed hypnotherapy would be helpful in cases of diverticulitis. However, other practices that can help your body be placed into a more relaxed state, anything that can move you from the fight, flight, freeze state to a rest, relax, digest phase can overall reduce your level of inflammation. So not necessarily hypnotherapy. I would encourage the person who is interested in using other techniques to manage diverticulitis to find a mind-body practice that will help them move from fight or flight to rest, relax, and digest.
Okay, thank you. Trying to think what else we have. Let's see. Can you tell me what the difference or the benefits of seeing a physician like yourself, maybe, who could do hypnotherapy versus maybe a therapist in the community that does hypnotherapy? Like the benefits of a community person versus a physician that does it in a more medical setting?
Well, that's a tough question to ask because it really is a person to answer.
Okay.
Sorry, because that is a very personal choice. But a skilled psychotherapist should be able to integrate the aspects of diet, for instance, to manage IBS, not just hypnotherapy. As a physician, of course, trained in integrative medicine, I make sure that I put that in play. Diet, as I mentioned, dietary intervention is an important piece in the management of IBS. So maybe that's something that a physician knows that a psychotherapist may not necessarily know, but again, a skilled psychotherapist who is interested in IBS can make this part of his or her toolbox as well.
Okay. Do you have any problems with patients adhering to the full length of the Paulson hypnotherapy protocol?
I have had only one person who has not been able to complete this protocol. And this person has also not made any of their appointments with all the other physicians involved in the care. Mm-hmm. So I don't think it's related to adhering with the protocol itself. There's something else going on.
Okay. And then we have one more question is, you've mentioned integrative medicine, but could you kind of explain it to me? It's a new term to me.
All right. So integrative medicine is a practice of medicine that is patient-centered and relationship-based. And it uses safe and effective interventions from complementary medicine and conventional medicine, and collaborates with different professionals so that the goal is not just to treat the disease, but also to optimize health. So. I can refer, for the one who's asked this question, the National Center for Integrative Health has a website. So this is an NIH site, and there's a lot more information about what integrative medicine is and what it covers. So NCCIH.
NCCIH. Okay, great.
Yes, and you can also go to our website, because our website also has information about what integrative medicine is. You know, the
your website has a
practical
lot
nuts
of,
and bolts.
yeah, your website has a lot of information. I believe that in the emails when people registered, there's links to your website in there if people are curious about that and want to get more information or any information like that. So this is just kind of a broad question. So are there any certain physicians that only treat and diagnose IBS?
Only treat and diagnose IBS.
Yeah.
Well, IBS is part of a big umbrella of GI disorders. So, and there are different, so let me just flip it. There are different physicians who are interested in IBS. So there are gastroenterologists who may have a specific interest in IBS. There is a subsection in the American Gastroenterology Association where they are interested in functional GI disorders. So not just IBS, but functional dyspepsia, functional constipation. So there's a subset of gastroenterologists who are interested in that. There is also a subset of physicians, integrative medicine physicians, who are interested in it because they use a particular therapy, like gut directed hypnotherapy. So I am not aware of one, a certain physician who would say that that's the only thing they treat.
So
I don't know how
in general
that is,
UF,
but that's.
So probably in general at UF Health, if you contacted GI, they would, and told them what was going on and what you needed, they would get you to a person who could treat you and evaluate there, because most of the GI docs are going to be able to take care of that.
Well, most of them would be able to work the patient up properly, evaluate the patient properly to make sure that this is indeed IBS. And they will offer, the therapy that I mentioned, which is medication or dietary intervention. Some of them are already starting to become more aware of gut-directed hypnotherapy. So some of my patients have actually come from our gastroenterologists, but most of them have been referred by their primary care doctors.
And is there a certain age that do you only treat 18 and up, or could a teenager maybe benefit?
So generally, my practice is restricted to the adult population, but we have made exceptions for adolescents. So I have the youngest patient I've seen, not necessarily for gut-directed hypnotherapy, but for an integrative consultation, is 15.
Okay, great. All right, well, that's about all the questions that we have today. There are a few out there lingering, and we're going to message you directly about